Hello, everybody. We are going to get started in just about 1.5 minutes or so. Let's see, people are just joining on. Martha Livingston asks whether there'll be a screen for all participants. No, you're just gonna see the panelists on this one. There's about, I don't recall, 700, 800 people registered for this closing plenary. So we just do the panelist screen for this one. Okay, we are going to get started. Thank you all for joining us. My name is Mark Dudzic. I am the coordinator of the labor campaign for single payer healthcare, and gonna try to moderate this closing session. First, before we get started with the discussion, we have some unfinished business. I think a couple people said they weren't able to find the link to make a contribution yesterday when we made the fundraising pitch. So I'm going to ask Ben to post it in the chat box and keep it live throughout our discussion. This is an absolute imperative. We have got to provide the kind of support for the organizations that are putting these conferences on and moving us forward. You need to reach in your pocket and make a significant contribution to healthcare now before this day is over. So if you have not yet done it, please step up right now and do it. And then we'll keep refreshing that donation form. So we thought, as a closing plenary on this conference, that we would try to spend a few minutes reflecting on this strategic moment and what we will be taking away from us as a result of this conference. So to help us do that, we're joined by a real distinguished panel here of fighters for healthcare justice. First, we have my good friend Martha Kuhl, who will be speaking on behalf of the steering committee for the labor campaign for single payer. Martha is a nurse at Oakland Children's Hospital. She's a treasurer of the National Nurses United, and she helped launch the labor campaign for single payer in 2009 and then served on our steering committee ever since. Also joining us is Vinay Krishnan. He is the national field organizer for the Center for Popular Democracy, a noted mental health advocate. And Vinay also serves on the board of Healthcare Now. And then we have Connie Huynh. She is the director of the Healthcare for All campaign at People's Action. And Connie also serves on the board of Healthcare Now. So we're going to start by asking each of you what one important takeaway you have after attending this conference, what you're going to bring back with you from this conference. And I'm going to start with Martha.
Hi, everyone. One of the fabulous things I've experienced this week in all the presentations and in the workshops today is that we are more and more recognizing the diversity of all of our experiences, and we need to build on this. And it's also emphasized the importance of rooting out structural racism in our country, in our healthcare system, and the implicit bias that many of us still have to actually build unity in this movement and to move Medicare for all forward. And I just want to add, as a nurse, that Medicare for all, if we'd had this, many lives would have been saved, and I would have had PPE on my job. So,
Connie?
Hey everyone, Connie Quinn. So the thing that rises to the top for me from this week is that, and I know we all know this, but we are fighting a system of violence, right? The health industry is violent. We come to this as experts on our own lives. Each one of us has our experience of how we've been impacted by the healthcare industry, and we're experts on our collective vision, the policy, the mechanics of how we get there, right? But holding this conference in COVID means something to me, as I'm sure it does to everyone here. And it regrounds me in the fact that this is an issue of state-sanctioned violence, right? It's an issue of mass life and death, extreme suffering that in the pandemic exceeds, both the Vietnam War and World War II, just in coronavirus deaths, right? So we have a lot to overcome. And, building on what Martha said, we need to urgently organize with communities of color, right? Who on multiple fronts have been impacted by the healthcare system and where there is great distrust, right? And we all know why there is great distrust. And so that means that we have a responsibility as organizers of this movement to build that trust, right? And we're not organizing to increase access to a violent system. We're organizing together to dismantle a violent system, right? A violent healthcare industry. So we need to eliminate that. And that's sort of like, that's the thing that rises to the top for me, is that is what binds us, right? And so that gives me a lot of hope coming out of this conference, to know that we're all fighting together for our collective right, not just for healthcare, but to live and to thrive.
Thanks, Connie. Vinay?
Yeah, so thanks, Mark, for the intro. And yeah, Martha mentioned diversity, and Connie did a great job talking about state violence. So my main takeaway building off of that is, from this conference, is that this is a really great opportunity to expand our base and be more inclusive in the advocacy that we're doing. I mean, often in healthcare work, we're very siloed and kind of separate from other work, but you saw throughout the conference, there was a workshop on migrant justice, there was a workshop on racial justice, there was talk about disability justice. And if you think about the moment we're in, it's not just COVID, right, that defined 2020. It was also the summer uprisings against police and the criminal justice system, and people working to divest from the criminal justice system and invest in healthcare. And we often think of those as different, distinct stories, but it's really one story, right? In that we're combating white supremacy and state violence, as Connie mentioned. And one of the most important ways to combat white supremacy is to combat ableism, right? Which is deeply entrenched in all of the systems and structures in this country. And the best way to do that legislatively is to pass Medicare for all. So I'm encouraged that this is an opportunity to expand our base, collaborate with other activists working, who are often in their silos. And this is a great opportunity to be making the best arguments that really tell the full story of American systemic injustice, which is white supremacy and ableism. And so I'm also excited, as Connie is, because I think this is the best time to be making those arguments.
Thanks. So I hope all of you have had an opportunity to engage with the 5 strategy questions that we laid out at the beginning of the conference. Really tried to put some thought into that. Many of you put up some postings in the gather room if you were able to find it. I know some people were wandering around looking for it, including myself yesterday. But also feel free to use the Q&A function here to add any thoughts, and we're going to try to take some questions as we move on here. But wanted to just quickly kind of go pick a couple of ideas from the postings that we saw and maybe discuss them each one for a couple of minutes. So the first question was, organizing in 2020 was difficult without the ability to safely meet in groups, and we are likely to face continued restrictions for much of 2021. What are the most effective tactics and campaigns you have seen from our movement or others that are safe with distancing? So there were, a few postings on the boards on this issue. Folks in Oregon say that they've been doing Zoom house meetings, and they do it very, kind of a very tight thing, a 15-minute presentation, and then some Q&A. They said it was fun and easy to do these events, and a number of people had suggestions like that. Putting urging politicians to do Zoom hearings and insisting that happen and that there be an opportunity to have political input on that. But I think that actually there's four, massive examples of people organizing over the last year that we need to take to heart. And as we think about building our movement and scaling up our movement, these are the kind of things that we got to look at. Number one, the heroic fights of healthcare and other frontline workers for self-protection. Workers all over the country took action to demand proper protection and to for themselves and with healthcare workers for their patients. Nurses often led this fight, but these fights were waged, with under horrific odds. People were fighting for their lives, and they found ways to step out to get the attention of the world and to begin to fight for their protection. And then, secondly, the Black Lives Matter uprisings against police violence. Again, people found ways to forcefully demand those changes. And sometimes perhaps they stepped a little over the bounds of what a public health expert might consider as appropriate social distancing, but they found ways to do this that created community and created the kind of force and demand for change that had people sit down and listen. And then, I don't know how many of you have followed this, but National Nurses United won a landslide organizing victory among 1,800 nurses at Mission Hospital in Asheville, North Carolina, in the midst of this pandemic. This happened to be the largest organizing victory at a Southern hospital since 1975. Now, I'm, a union organizer by craft, and I know how difficult it is, even under the best of circumstances, to have the kind of face-by-face, one-on-one organizing that you have to do to win an organizing drive against a devoted foe like Hospital Corporation of America. So, they found ways to organize in the heart of the Right to Work South, the state with the lowest union density in the country. They found ways, 1,800 nurses found ways to organize themselves. So they did something right, and I'd like to hear a lot more and learn from that experience. And then finally, the Union Unite Here did massive deployment of unemployed hospital workers to battleground states, hitting the doors in battleground states when many people were saying, we can't talk to people one-on-one, we're gonna have to rely on phones and texts to reach people. They found a way to do this safely, protecting their members and protecting the people they were talking to, and talk to hundreds of thousands of voters and potential voters. And I believe that they could very well be the difference that won Nevada, Arizona, and Pennsylvania for Biden, and the difference that won the 2 Georgia Senate seats in Georgia. So again, we've found ways to triumph over COVID over the last year. We have to think about these big organizing ideas as we scale up our fight for Medicare for all. So the second question was, what are the greatest new threats to the Medicare for all movement that you see in 2021, and how can we best mitigate these threats? Some of the things we saw in the posting was the disinformation that our enemies will put out, the fear mongering about you're going to lose what you have, and all of the other concerns, the rise of Medicare Advantage plans and how they're going to undermine traditional Medicare. And then a couple of people mentioned the fact that we're so relieved at getting rid of Trump that we may relax and not continue to move forward. So there's some good thoughts there. And Vinay, what else would you add to those to that question in an answer?
Yeah, so this isn't necessarily a new threat so much as it's like one of our most deeply entrenched threats. And I think that's a kind of narrative battle that we always have, especially with the right wing, this kind of propaganda we hear, the most common one being that, how are you going to pay for it? You can't pay for Medicare for all. And like, we know that's not true. We know that's a bad faith argument. Not only can we pay for it, but it's cost saving, right? It's actually going to save us money. And we're already paying more than anyone else in the world for healthcare and getting much less than anybody else in the world. So that's a bad faith argument that you're going to hear a lot. And I think you can kind of frame those narrative battles in two ways. One is like a failure of imagination, right? Like people just say like, this isn't possible, it can't be done here. And it's kind of our job as organizers to expand people's imaginations. Like anytime anyone's tried anything bold, whether it's, abolishing slavery or integration or the New Deal or Social Security, Civil Rights Act, people would always say like, oh, it's not possible, you can't do that here, until they did it. And then it was possible, right? So of course we can do this. And we have to remind people that if we're gonna create a new world, we have to actually be creative, So I think making good arguments about kind of expanding what's possible in America. And the second kind of realm of it is what our values are as people in this country, because the right wing will constantly say, oh, it's like un-American, Medicare for all is un-American because it's like socialist, and they'll use it as if it's like a four-letter word, and just trying to say it's against our values. And we need to be making arguments against that, saying like, no, it's very much in our values that if you are sick in this country, you can see a doctor and it should be free, and it should not, put you into debt. It should not make you choose between healthcare and food, or keeping the lights on, or keeping a roof over your head. That's very much within our values. And it's, valuing the principles of disability justice, and combating ableism, anti-ableism, anti-racism. So that whole narrative battle, countering bad faith arguments, making people understand what's possible, and kind of agreeing on this is very much entrenched in our values in this country. I think that's something we're all going to have to be really good about and find ways to be really good storytellers about as we do this work.
Thanks. So question 3 was, what outcomes in 2021 would mean that it was a successful year for our movement? Again, looking at the postings, congressional hearings on Medicare for all, at least one Republican co-sponsoring Medicare for all legislation, more labor support for Medicare for all, get waivers for states like California. So those are some of the ideas we saw on the walls. Connie, do you have any other thoughts on this?
I think that all of those are really important things. Obviously there's no shortage of ways that we can advance the movement in this next year. I think there are two things that I think are really important. One, centrists and conservatives still don't want to talk about the very basic thing of expanding coverage in the pandemic, and that is a real problem. So we need to not let them get away with that. We definitely need to force the issue to make sure that it rises. And then also growing our movement, right? So that's them, what they're going to do, but let's talk about us and our communities, right? We can't let people accept the fact that the status quo is in some way, a fact of life or nature. We know that it's not, right? And we need to make sure that we're actually talking to people that are not yet in our movement, so that popular opinion doesn't resign to the fact that the healthcare industry can't be overcome, right? So we want to make sure that we're talking to real life people, showing movement, right? So whatever things we can win, whatever shifts we can make, that those things are happening. We're owning and celebrating those things, so that people see that there's actually an opportunity to overcome, again, the violent system that we're in, and to commit to building with us.
Great, thanks so much, Connie. Question 4. What groups or unions in your state are not yet involved in the Medicare for All movement who need to be involved for us to win? How do we overcome their objections? How can we get them on board? So first of all, I saw some posts with questions about specific unions. I am going to enter the contact email for Labor for Single Payer. If you have a question about a specific union that you are working with, contact us, and if we can help you, we will. This is, we'd really love to help reach out to specific unions. So, but contact us at organizers@laborforsinglepayer.org. We'll get back to you over the next few days. And then also on the postings, there was listings for faith organizations, racial equity and racial justice organizations, Sunrise Movement, small businesses, and groups such as that. So Martha, you had some thoughts about how we, not only need people there, but we need to learn how to move them to action. So
yeah, there's in my area and across the country, we know there's unions who have endorsed Medicare for All. The AFL has, CLCs have, individual unions have, yet they haven't made it their foremost or one of their most important struggles for all of us, for common good. And so we had the steps are how to figure out to get them to make those next steps. And the other thing we've been thinking about is that for unions that haven't yet even gone that far, actions by members, especially in your contract campaigns, are opportunities to educate each other about what the real solutions are when you're fighting to save your own health benefits. We all know we should get them off the table, negotiating table. You can ask your union to have you be a delegate to your local coalitions and local CLCs and raise issues with other union members, because the members can actually push their leadership in unions to be more progressive. And often that is what it takes. Fortunately, I'm in a union that has taken leadership on this issue, so I haven't had to push. I've gotten to work with them. And then the other thing that's important in terms of groups is even identifying who in your community is, what the other groups are. Because sometimes am I going to say your name right? Vinay was saying that people, we're siloed, right? You have all these little healthcare groups or groups around different issues, and we're not talking to each other. And yet our struggles overlap. So identifying the groups. And in California in particular, I have to say, there is a lot of Spanish speaking and groups. And in other communities in other parts of the country, we know there's groups of people who, speak many languages, right? And so to identify and make information available, I know that we are in California starting to really make an effort to make all our information available in both Spanish and English to reach out. So I think that there's a lot of work that we could do in terms of identifying and building, as Connie was saying, building trust amongst all the different groups. So we're moving forward together.
thanks. And then the last question, Biden is president and Democrats control the House and Senate. How do we keep momentum on Medicare for All when Democratic leadership is likely to introduce incremental health reforms? Are there any measures short of Medicare for All that would advance our movement? So we saw on the walls suggestions like ending the Senate filibuster, state waivers, pharmaceutical regulation. Vinay, do you have some thoughts on this?
Sure, yeah. So one measure that would be short of Medicare for All, but still something at least my organization is very much supporting, is the Healthcare Emergency Guarantee Act. And anyone who's not familiar with that, it would cover everyone's healthcare in the country for the duration of the COVID crisis until a vaccine is widely available to everyone. So for example, if you're uninsured, your healthcare would be covered. And if you already are insured, your copays and deductibles would be taken care of. So if you were to imagine how this would play out, if that were to end up, passing, and cover everyone's healthcare for, I don't know, 6 to 8 months. It's hard to say how long this crisis will last. At the end of that period, it'd be very, very difficult for the government to take that away from people, right? By that time, we'd have a whole new army of storytellers, people whose lives would be transformed by this legislation, who will be arguing very passionately to maintain such a system. So it could be a way to kind of a stepping stone towards Medicare for all. And right now there's some buzz to move that through the budget reconciliation process. And if you're not familiar with that, it's basically a way to do it in a filibuster-proof method. So it's very possible right now. There's some momentum building on that. So that's one example I would give.
How about you, Martha? You having some idea on this?
Well, yeah, but I'm gonna actually say I want to talk about what NNU is doing in both nationally and in California, because we are really, you know, as we've said, we control both houses of Congress. We have a Democratic president. We have this opportunity, and yet we know we still have to push and push incredibly hard. So we have our national campaign where you can become a district leader to push your congressperson or your senator to support Medicare for all bills. You can join a rapid response team. You can call and text and others and build the movement that way. And outside of your district, if you're in a district where your congressperson already is a supporter, and you can sign up for leadership schools and get groups and organizations to sign a patient over profits pledge. So there's those actions that we're going to use as pressure tactics. And then we're also looking at a California, campaign, a state campaign, because it's not an either or. We have to push it on both fronts, right? So if we have a campaign starting that's called CalCare, and we're going to have a kickoff with a big events all throughout California, we're going to talk about the issue of waivers, but we think we have to get we want to get a bill sponsored as soon as possible. And we're working with other groups in California to push our electeds and our governor in that direction. And we will have movement building trainings. And we're also reaching out to artists. Anybody, we have many people here today. If you're an artist of any kind and want to participate in moving the agenda for health justice with your artwork, we're thrilled. Somebody was talking about berets earlier today, so I like berets. And then our Spanish speaking campaign is really important, because I want to say probably for, I don't know the number, but in where I work, at least more than 50% of the people are patients and families. Their first language is Spanish, and they're in a healthcare crisis if I'm taking care of them. So to have that campaign is really important too. So that's a pressure campaign on many fronts and many places to get involved. And I'm sure somebody's throwing those links in the chat.
Thanks all. Those are all great ideas. And I know that, you know, everybody else at this conference has a boatload of them also. And I wish we could just keep going on, but we have a few more minutes for some questions. Ben, what are you seeing on the Q&A thing that you want to throw at us?
Surprise, I'm here. So there was a great question from Peter Shapiro, and this one is kind of related to one of the strategy questions, but it's an interesting reformulation. He asks, how do we achieve unity around whether or not to accept incremental reforms, and if so, which ones?
Oh, someone want to take a shot at that?
Well,
Connie? Oh, go ahead, Martha. You put your hand up first.
The other night, watching the other panel with Ben and Stephanie and Alex, Stephanie had her little whiteboard out and was writing around what were the good incremental reforms and what was not. And I think that's a way to think about it. It's like what actually moves us closer, as opposed to what keeps the insurance companies and for-profit providers and all those things in the mix, right? So I think there is a way to think about this, about what reforms actually, not just, I mean, the ACA helped millions of people get health care, but insurance is still in the mix. So it didn't, I don't know how to think it. I think that that's important, but I think now's the time to actually really push the reforms that get the insurance companies out of the mix.
Cool, great. You have another one for us, Ben?
Yes, I do. There's a bunch of good ones on here. And folks, feel free to pop your questions into the Q&A section on the bottom of the menu there. So there's a question from Sam Wickham, and this is related to our allies at Public Citizen. In this moment, do you feel that winning non-binding resolutions for Medicare for All in towns and cities across the country are a good economical use of our power that will help push us closer to Medicare for All?
Anybody want to take that one? Go ahead, Vinay.
I can speak to it a bit. Yeah, we've collaborated with Public Citizen a bit. I would definitely defer to them as the authority on those resolutions. If you're not familiar with them, definitely check out their work. And I think that's actually a good example of the previous question, right? In terms of an incremental reform, it's not national, right? But that is incredibly significant. It would affect so many people, and it also kind of normalizes these discussions and normalizes kind of the narratives I mentioned earlier and helps us get towards Medicare for All. And I don't think it's an either or. I don't think we have to choose between incremental reform and like the big goal. I think we can like push for both. We can protect the ACA, push these resolutions, expand Medicaid, and still swing for the home run. Like, let's be as far out as possible and push the whole narrative, the whole collective imagination as close to what we want as possible.
Thanks. What else you got for us, Ben?
Well, this is a question from anonymous attendee, a good friend of mine. He or she asks, what are good short or medium term campaigns we can use to build our power? This sounds like a question from an organizer.
That sounds like a question for you, Connie.
So, I mean, I feel like this is rooted in a number of questions that have been raised so far, but I think, you know, as we look forward to 2021 and the years going forward, like, we should also recognize that like the resolutions campaign, you know, there are other things that we can do that are non-legislative to challenge corporate power. That is going to be a huge one going forward, right? Because no matter how much, you know, how often we show up at our representatives' offices, you know, there are corporations in the mix, right, that are standing in the way. So we've got to really challenge corporate power. So People's Action is really committed to ensuring that, you know, the corporate interference in our healthcare system, in our politics, rises to like everyday household conversation, that we're actually naming those folks, right? All of the groups here are part of the national coalition that is behind the Patients Over Profits, you know, pledge campaign. So I think that those are important sort of things that we can do that are non-legislative to also address corporate power. And, you know, as we build for Medicare for All, we also need to recognize that our communities need medicine, right? Right now, we all need a vaccine. And so pharmaceutical monopolies are really a challenge and are an obstruction to our ability to get the medicine that we need. And so also, again, like, you know, tackling pharmaceutical monopoly power.
Great.
And we all paid for that vaccine, right? Boy.
More than we should have.
Okay, Ben.
Yeah, we've got a great question here from Rita Valenti. Shout out to Georgia. Rita asks, what would it mean in terms of expanding our work for Medicare for All if our organizations and unions also supported and signed on to the BREATHE Act? The BREATHE Act, of course, divests from policing and reinvests in a non-policing solution to public safety.
Connie, you're shaking your head. You want to take that up?
So the question is, what would it mean for our movement, right?
Yes.
Yeah, so I mean, I think, again, going back to building trust, our organizations need to not only call on organizations led by people of color to join our movement, but we also need to answer the call and show up on issues for communities of color as well. So I think that, again, it's a step towards building trust. I think it also opens up the pathway, right? Like if we were to divest from policing, that money could go towards our healthcare system. That money could go towards us taking care of one another. And we could reprioritize our values. So, but I see Vinay wants to jump in.
Oh, I was just going to agree with everything you said and just kind of tie it back that it's a similar enemy, right? It's a white supremacist state that we're combating systemically, not just like, interpersonally. And that's filtered throughout our healthcare system, throughout our criminal justice system. So there's just so many intersections there, so many opportunities to collaborate.
Yeah, I mean, look, there's a style of work in the labor movement. If you want to, you want to work with somebody, you better show up at their picket line when they're in a fight, and then maybe they'll show up when you're in a fight. So it's how you build solidarity and you build a movement. Go ahead, Ben.
A very simple question here from Stephen Cook. Can we get rid of Medicare Advantage?
Who wants a piece of that?
Well, I think we can, but I think it means passing a real improved Medicare for all bill, right? That's getting the insurance companies out of the mix. That is, they're siphoning off a huge amount of Medicare dollars. They love Medicare because it's public money for private profit in those Medicare Advantage plans. So any reforms that move us closer to getting insurance companies, big pharma, and horrible big providers out of the mix would be great. And I don't know how to get Medicare Advantage except for getting people aware about what traditional Medicare offers. And right now, they've made it really hard to get complete care in by changing the rules along the way.
Yeah, I think this is really important. I think this is actually a way to build an alliance between current Medicare recipients and the people and expanding it to everybody, because Medicare is under this huge privatization threat through Medicare Advantage, and it needs to be improved for current recipients along the model of the Medicare for All Act in order to have a robust social insurance program. I'm going to make a quick shameless pitch. February 2nd, I'm going to be on a webinar hosted by the Puget Sound organization of retirees on Medicare. It's called Medicare Disadvantage, on this very topic. And since we are living in the world of Zoom, we will be sending a link out to anybody who's interested in exploring this in depth. We're going to hear from Wendell Potter and Diane Archer and the Puget Sound retirees on this issue. Okay, Ben, I think we got time for one more question.
All right. Well, there is a few questions about pushing Biden and how we can push Biden, but I'm gonna take this one from Stan. He says, "How can folks push back against Biden and his obsession with COBRA, which is unemployment based when over 68 million people are unemployed?"
I'm going to give you, each one of you, a shot at this, and then we're gonna have to wrap up. So, Vinay, you want to start?
Sure. My default always is to say we gotta tell our personal stories. I mean, COBRA is just so impractical for so many reasons for so many people, and we know that employer-based insurance just does not work. We knew that before COVID, but COVID has clearly illuminated that it's just unworkable and also unjust. And we combat that by people who are directly impacted telling their stories. I've said it over and over again that if you're an expert on your personal story, then that's all you need to be an advocate for Medicare for All. It's all you need to bird dog or set up a lobby visit or send an email or a call. And if we do that strategically over and over again, I'm confident we can move this whole country in a more just direction.
Okay, Connie, any last words?
Sure. I mean, I think we all know COBRA is not enough, right? And we need to make sure that that is heard loud and clear, right? That COBRA just isn't a solution. We are in a massive crisis, and to try to use that as some sort of a fix is just unacceptable. So continuing to lift that up, And then, yeah, I'm on board with Vinay, continue to tell our stories. I have a personal story in my family about how Cobra has fallen far short. And yeah, we should just continue to tell them.
Martha? Last
Yeah, my biggest fear with Biden has been that it'll just be business as usual, that he'll do some good things and then we'll return to normal, which, as we've all said, is horrible, especially in healthcare and with the racism in our country. So I think, though, that we have to treat Biden like we would treat any politician, right? And he's at a moment of huge crisis in our country, and he's already signed a lot of, done a lot of things that are going to actually probably it was save lives in this COVID pandemic. And so he's in a moment, he's vulnerable in this moment to us pushing him further, I think, because there is so much discontent, so much inequality, so much rampant racism, so much all of those things that are troubling our country, that he might be more pushable than we think. And so I'm balancing myself on this question. Is he going to return us to neoliberal market control of everything? Or are we going to make these huge next steps that we need to make? And we can only make it if we build this movement, move us all forward, struggle together, and recognize on this issue and many issues that we're all in this for the common good, right? It's so important.
What wonderful final words, panelists, and thank you so much for weighing in on this. It's really great to hear all of your voices. One more pitch for money. Ben, if you want to repost that donation page, please, folks. This is not, movements don't live on air. We need dollars and cents to build this movement. This has been an amazing conference. Over 1,100 people registered for this conference. Unlike union conventions, we did not have a gigantic staff and a huge budget to do this. We did this on a wing and a prayer, and I really want to thank in particular the sort of the core organizers who put this thing together. Ben Day, Stephanie Nakajima, and Catherine Isaac worked together as a team with me to help make this happen. We worked with some amazing interns that Healthcare Now has recruited. This is very unusual, but they have interns love Healthcare Now so much that some of their former interns returned to help with this conference. So that's pretty cool. And a whole bunch of other volunteers, especially our poor beleaguered Zoom operations crew who struggled through some real glitches, particularly yesterday, getting everybody, all these workshops to work. I think hopefully your blood pressure has lowered significantly since those initial glitches. I want to thank the sponsors for this conference. And their names and logos are posted on the Schedge page, and you should thank them yourself if you come across them. And also those of you who donated for scholarships. Thanks to all of you who made those donations. Over 250 scholarship were given, and 250 people attended this conference who would not otherwise be able to do that. We will follow up over the next few days with some links to conference materials and other follow-up issues. The presentations, the pre-recorded presentations will all be, you'll receive links and postings on that. I urge you, if you haven't seen them, to see them again. And then finally, I want to let all of you know that I will be retiring as a national coordinator of the labor campaign for single payer in the next few months. I had really hoped to kind of go out in a burst of glory. I was planning to wait until the newly elected President Sanders signed the Medicare for All Act of 2021, and that we converted the labor campaign into the labor campaign to defend Medicare for All. But history had other ideas, and it just was not to be. So I will be retiring. I will not be disappearing. I'm going to continue on as the chair of the labor campaign as long as the board will have me. And I will try to be as active as I can be. But I wanted you all to know what an honor it has been to work with every one of you. You hired me back in 2009, and the unions and the supporters of the labor campaign have seen fit to basically pay my salary for the last 11 years now. And it has been the best job in the world. It's my dream job. I, get up in the morning and I fight for Medicare for all. What could be better? And thank you all for doing that. And I know that, the dues and the contributions of really hardworking people has made it possible for me to do that. And I hope that I've met your expectations. I've done as best as I can. And, I also have to say that this job sure as hell beats standing over pickling tanks filled with sulfuric acid, as, I kind of started my life doing in the oil, chemical, and atomic workers. So I hope that you'll all continue to support the labor campaign for single payer and healthcare now, and stay with us as we journey on towards healthcare justice. And, the one thing that I've learned and that I hope I've been able to impart over these years is that the way we win is solidarity. The way we win is building a powerful movement and standing up for one another, holding the line and moving forward. Solidarity forever. An injury to one is an injury to all. The health of each of us is dependent on the health of all of us. So thank you all for attending this wonderful conference. I hope you enjoyed it. There is a gather cocktail event if you want to wander around and look for your friends and colleagues. That will be opening right now, and we'll keep that open for another hour or so. So thank you, everybody. And I will see you in person next year. Take care and good night.